Breaking news! Before approaching the plan of action to fight off the flu virus, it is important to understand the virus and how it came about. Influenza, known as the flu, is a disease that attacks the respiratory tract, the nose, throat, and lungs, in humans. Although mild cases may be similar to viral, cold influenza is typically much more severe. The flu tends to get passed around through drops of bacteria in the air from sneezing and coughing. The flu virus is not necessarily fatal. However, if it is left untreated, it can become serious. Also, the simple flu virus can become more powerful if mutation does occur. When strains of avian influenza interact with the common strains of human influenza, a mutation can occur, creating a virus capable of human-to-human transmission, initiating a pandemic. This mutation process is one that begins the pandemic process, which is what we as a team are trying to prevent.
The best way to fight off the spread of influenza is the practice of vaccinations. Safe and effective vaccines have been available and used for more than 60 years. The use of vaccinations must be taken advantage to. The best way to fight the spread of influenza is the practice of vaccinations. Safe and effective vaccinations have been available and used for more than 60 years. The use of vaccinations must be taken advantage of to keep the herd immunity at or below 86%. Another thing to take into account is the age population when dealing with the infection. Seasonal influenza is a yearly occurrence that kills primarily persons aged 65 and older and those with chronic health conditions and causes significant economic impact. This is a great factor to consider when vaccinations are being given out. Most infected people recover within 1 to 2 weeks without requiring medical treatment. However, in the very young, the elderly, and those with other serious medical conditions, infection can lead to severe complications of the underlying condition, pneumonia and death. Essentially, the facts of the young and the elderly succumbing to the worst infection comparing to other age populations must be determined when. Essentially, the facts of the young and the elderly succumbing to the worst infection compared to other age populations must be determined when dealing with vaccinations. Among healthy adults, influenza vaccine can prevent 70 to 90% influenza-specific illness. Among the elderly, the vaccine reduces severe illness and complications by up to 60% and deaths by 80%. Though the elderly have the hardest time dealing with influenza, the vaccine still has a great percentage of fighting off the infection. Our first step would be public awareness. Our main goal as researchers for the California Department of Public Health is to prevent the spread of influenza, and one way of doing this is by the spread of knowledge about the contagious flu. The first step to our proposal is creating and informing the public, which is just as important as the use of vaccination to prevent panic-related uprisings, especially counties that are largely populated. As a comparison, the way the AIDS epidemic was at first went without much notice, which gave the disease more power of spreading and eventually becoming more and more common as people were dying. To conclude, it is important to inform the general public in ways to not create panic, but an understanding so that the disease may halt from spreading. Also, leading into our next step, information regarding the locations of vaccines would be included, as well as information of effectiveness and side effects. If the public is aware of influenza and vaccinations, the more likely people will be willing to cooperate in the process of eliminating the disease. Our step 2 of our proposal is priority vaccinations. Our best defense system we can have is the proper use of vaccinations. In our plan of action with vaccinations, we would like to give first priority of the vaccination to those who are more inclined to be hit with the influenza severely. This means that people over the ages of 65 would be the first to receive the vaccine, followed by children 5 and younger, and those with weaker immune systems. Our logic behind this is as follows. Those who are more inclined to catch the disease first and would have a harder time fighting it off will be given aid to the influenza, and it will help stop the spread the fastest because it will reduce the chances of the greater population obtaining the disease.
Our third step is how to remain the vaccinations. After step 2, the remainder of the vaccinations will be dispersed to counties according to the population density. Example, from highest to lowest population. The decisions that will follow have been according to the map from Social Explorer. Therefore, the counties that would get the greater remaining vaccinations are those like San Francisco, Riverside, and San Diego, versus the Central Valley and more desert areas. This plan of action will be effective by creating the highest herd immunity. because the highest populated counties will be immune. On a side note, the smaller counties like the Central Valley will not be as dependent on vaccines as higher populated counties because they will not be in as much contact with the disease. On another side note, the vaccinations will only be given out through health centers that will be set up strictly for the purpose of distributing vaccines to ensure that people are getting their designated one dose. Also, this system will eliminate vaccine waste and ultimately produce an organized and more effective system.
Our step 4 of our proposal is separation of infected and healthy. Once public awareness and vaccines have been organized and distributed, the next procedure that needs to be taken is the division of remaining people already infected and unable to obtain vaccination and healthy individuals. Basically, what we're trying to do here, people, is separate the healthy individuals from the infected individuals. Here's our guidelines. Infected people must be subjected to designated isolated areas so that they do not pose a threat to the general public. These areas will be sealed so no floating bacteria can cause any harm. All infected people must be kept on a record and/or file so that the government has documentation. Healthy outsiders may not visit those who are sick unless they have the proper safety precautions, such as proper attire, and all visitors must be accompanied by an escort. Infected and isolated citizens should be treated whenever more vaccinations become available. And our last step to our proposal is step 5, extra and simple precautions. When it comes to fighting off the spread of influenza, the general public needs to be extra cautious of their personal health and hygiene as well as others. This being said, parents with children need to be in full command of their children and keep their eyes on their kids at all times. People with low immune systems like the elderly and children under 5 are required to go through regular checkups at the health facilities to ensure that their health is not a danger to the rest of the population. In addition, the rest of the healthy public can implement safety procedures with simple tasks such as washing hands after they finish any task and staying away from people, places, or things they believe may have relations to the influenza.
Our research team predicts that the ending result of our proposal after it has been enacted will conclude with the herd immunity being met to standard, which will stop the threat of the influenza. Our team cannot ensure that there will not be any deaths, which should be duly noted as this is an outbreak and unplanned casualties do occur. We also cannot guarantee that the general public will manage themselves responsibly. However, we strongly believe that our proposal will protect the general population as a whole against the flu epidemic, and that our proposal offers various strategies that will prevent the spread of an unwanted disease.
This is Channel 5. We thank you.
Oh my god!
Okay, I don't know what we're gonna do.
Sorry. Was that first?
Because the highest populated countries count.
Our step 2 in our proposal. Sorry that took a century.
No, it's fine. I completely understand.
Oh my god, I didn't stop it! Oh my god, I thought I pressed the thing!